Hey guys, welcome back to Medical Coding with Blue. It is Q&A Tuesday. So if you're brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. I really love sharing the things that I know with all of you. So I hope you'll take a second, hit that subscribe button, hit that like button, and at the end of this video helps you, I hope that you will share it. Okay, so let's get started. All right, so all the questions that I get from the comments, from emails, from Instagram, I throw them all into one episode, and here we go. Okay, and if you have any questions for next week's show, make sure you leave them in the comment section below. All right, number one. I have heard that these things are true of medical coding, that it doesn't require a formal college degree, that you can work from home potentially, autonomy, that you're able to just do your own thing and get your work done with little management interaction, and that it pays well. Do you feel that those things are true, and do you think that those are viable reasons to pursue a career in medical coding? Yes, those things are all true. When it comes to working at home, though, if you are brand new and you have no experience, the pandemic aside, it would be difficult for you to start working from home, okay? But because of the pandemic, a lot of people are still applying at places that they need to physically go, and then they're still sending them home to code anyway because we're in a pandemic, and a lot of places are like hospitals and doctors' offices, they're leaving their coders at home. So you're still able to get in. I do have a viewer that was able to do that, but normally if you're applying with a place that it's hiring for specifically remote coders and you're brand new with no experience, it's going to be impossible for you to work remotely that way because you have to have experience. And that is something that it's just an industry standard. You know, they do want you to have experience before you code remotely. But like I said, if you're applying at a place that you have to physically go, they know right now there's limitations because of COVID. So they are sending their people home. But you can't just want to get into this just because of, you know, working at home or just the pay. Some people are attracted to medical coding because of the pay. Then they get into it and they decide they hate it, but they're sticking with it because of the money. If that's the case, then you should really consider, because medical coding is a lot. And because it's a lot, that's why the pay is so good, okay? And it can be the fact that you want to do this because you are looking at doing working independently. Yes, that's a really good reason to do it too, but you really should have a desire to want to dig deep and to work with your providers and things like that. It is all about working with the providers to make sure that they're documenting everything like they're supposed to. It's not supposed to be, well, I passed my certification exam, I got a job, and now I'm just going to coast along until retirement. You know what I mean? You can't do that. You have to always want to dig and look and investigate and make sure that everything that's happening is being documented appropriately and that the codes that are being selected appropriately. It takes commitment. You know what I mean? Like it's not something that you should decide on lightly, okay? Because it's an investment. You're going to be learning for the rest of your life. When you're in this field, that's what this is. You know, and in order to be successful at it, you have to continue to study. We have to report continuing education units for our credentials. Everybody does. So this is something that, like I said, is a continual learning process. If you are willing to do that, then yeah, sure, it could be for you, okay? But yes, do your research if you're just not sure. Check out my day in the life of a medical coder videos. I do have plenty of those where I'm just talking about what happens in my day and what am I doing. And I'm just sharing my insights, you know. And obviously, you know, you can check out the other videos that I have as well about tips. I have tip videos, so, you know, just be sure to look into those and see if maybe that will answer some questions for you. Okay, next question. I am looking to get out of bedside nursing, and I thought this may be a good option. How possible is it to do it from home as a newbie and then later with experience? Thank you. So you do have to have experience to work from home. A lot of times nurses will want to work from home and things like that, and they think because they have a nursing degree that they can do that right away. With medical coding, you have to have experience applying codes, you know. And the codes that the coding that most nurses will do before becoming medical coders is just like selecting from a list of codes that are available to them, like the procedures or the diagnosis that they do. So it's not actually like critical thinking with following the guidelines and following, you know, the rules and stuff like that. It's just selecting, and that's not the same. So you're going to fall into the same category as somebody that is brand new off the street. The only difference between you and that other person is you being an RN, okay? And RNs are really good for, they turn them into like clinical documentation improvement specialists, because a lot of nurses are going to be able to look at documentation and know that there is something missing, versus a coder who doesn't really know. They're just going to go based on what is in the documentation, whereas a nurse can say, well, wait a second, he's missing or she's missing this information or this information or this information. So there's a difference in the education level, okay? But a coder that is doing their homework and persisting and asking questions can be just as valuable as a nurse. So that is something to keep in mind. But if that is the case, just being a nurse is not going to immediately qualify you to work at home. And you would fall into the same thing like everybody else, okay? So, and again, like I said, COVID is allowing people to be at home. So that is something that you can consider when you are thinking of taking a course, okay? So, next question. I am interested in studying medical billing and coding course online soon. Do you think it is not yet too late for a 58-year-old woman? I heard some hospitals will not hire you unless you have years of experience. So, I knew a lady who was 61 and she got her medical coding certification. She has been in it. She's still in it. She survived the ICD-10 changeover. So, and this has been over 11 years. So I think if she can do it, anybody can do it. She was very inspiring when I met her. And, you know, it's all about you. It's all about what you want to do. I know a lot of people in their 50s that are just barely starting. Even when I was in school, there was people in their 50s, late 40s that were just barely starting. And as far as like having years of experience, like to work in a hospital, I have said many times on my videos that even if they are asking for years of experience, that you're still going to have to apply anyway, because you need to be persistent, and you can't let the fact that they're asking for years of experience stop you from still applying, okay? The only time, like I said, that's going to really hinder you is if you're trying to get a remote coding job, okay? But if you're actually applying at a place you have to go, then you will still stand a chance, just like everybody else, okay? But your resume needs to stand out, and you have to be willing to go above and beyond when you are writing out your resume. You know, your resume needs to be 2 pages, and you have to have a really good cover letter, and you have to be doing your research. And I encourage you all to check out my employment listings review videos, so that way you can see the tips that I have on there as well, because I'm reading all of these job listings, and a lot of them are for either brand new people or for people who have experience. And just listen to the things that I'm talking about in these videos, because it's advice. So, all right. But no, you are not too old. Don't worry about that. If you are willing to do the work, go for it. Okay. Next question. Due to COVID and when I graduated, my test for 2019 had to be pushed to August 10. The cutoff is shortly after that before moving to 2020. My question is, do you think that it is manageable to learn the 2020 editions myself if I need to retake the test? So worried right now. Okay, so when I see that, I always say this first thing. Don't let a negative thought be your first thought. And that's unfortunately the case here, where she's thinking, oh, you know, what if I fail? You need to have that thinking turned around. You're going to pass. You're going to do very well. There's not so many new additions to the 2020 versus 2019 that you're not going to be able to know it. Okay, you've been trained, and it's the same thing. It's just a few updated codes. Okay, as long as you're using the appropriate books, of course. The fundamental basics of coding has not changed from 2019 to 2020. Okay, so that's something to keep in mind. Don't worry and don't fret about things that are like that. Okay. Study, okay, but don't burn yourself out. And if there's something that you know that is tripping you up, then you need to focus on that. and worry that way, okay? But don't worry if you don't let that be your first thought of, well, what if I fail? You know, that's the one thing that's it's so hard to see that when people think that that's the first thing, and then what if they have to take this test again and it's going to be the 2020 version, and I don't know if I know. Guys, the coding didn't change from 2019 to 2020, so you know, it's just a few new updated codes. Big deal. Okay, you can do it. All right. Next question. I was wondering how proficient you have to be when it comes to math. I don't know why I continue to get this question. This is medical coding. This is not software coding. Software coding is where you got to be a math whiz, okay? Medical coding, there is no math in medical coding. And before you say, oh, yes, there is, okay, deciding a 1 or 2 units, 3 units, come on, guys, that's not math, you know, so that's something that you have to think about. No, there is no math in medical coding. If there is, it's very basic. So no, you do not have to be proficient. Next question. Do you think training for the CCA will help practice for the CPC, or are the guidelines totally different? So the CPC and the CCA are from 2 completely different organizations. The CPC is a 5-hour and 40-minute exam. The CCA is a 2-hour exam, okay, with AHIMA. So their test structures are different, okay? So that's something you have to look at unless you are going to a program that prepares you for both, okay? That is something that you're going to have to look at, okay? Sometimes people will say, well, this is a focus on the CCA. And some people will say this is a focus on the CPC. Or some people will say you can learn both the CCA and the CPC for this one so that you can test with either one. So it's up to you to make sure that you're knowing what your program is preparing you for. But they are completely different associations and they are completely different tests, okay? So the coding guidelines are all the same, all right? But these are just 2 different exams, okay? Next question. Can I work and still train for medical coding? Yes, you can, okay? The next question is, I'm looking into 2 different programs, the CPCS Medical Billing and Coding or the CPC Medical Billing and Coding. I have no background in the medical field. I have an ATA in medical office. I don't know what ATA is. After graduation, moved into a different area and worked in accounting for 23 years. I now want to move back into the medical field. Do you know the difference between the 2 programs? I think that the CPC is geared towards medical office coding and the CPCS is geared towards insurance billing. I will tell you this, in all of my time in looking up jobs in my job listings review videos, right? Nobody's asking for the CPCS, so you don't have to be certified to be a medical biller, okay? That is another thing that I want to tell you guys too. I don't know about the CPCS. Okay, all I know is when I'm looking for credentials, if you're looking to be a medical coder, you have to be credentialed through AHIMA or AAPC. So you have to have the CCS, the CCSP, the CCA, the RHIT or the RHIA, or the CPC, CPCA, and on. There's a bunch of different ones with AAPC. But you have to be credentialed through one of these guys, okay? Nobody that I've seen, and I've been looking in different states, okay? Because I don't focus only on one state. I put it like in a national search. I haven't seen a request for this credential. And you don't have to be certified as a biller to be a medical biller, okay? So that's the answer on that one. Do you think getting an associate's for RHIT is more beneficial / putting you in a better pay bracket than somebody who just has certifications? So when it comes to having a degree versus having a credential, there's not much of a difference. And as far as like the pay scale goes. So if you are really curious, you can look on these job listings and you can see that it does, I mean, it'll say what what the salary range is, but it's not very much of a difference. So it's really a personal choice if you want to get a certification or if you want to go to college. There's not, we do very well just having certifications in this field. That is the amazing thing about medical coding, is that you don't have to have a college degree to do very well. Okay, so that is something to think about. It's something to consider, because it is an investment if you're going to go to college. Obviously, you want to make sure that you're getting, you know, it's going to be a well thought out investment versus just getting a degree and not really doing anything with it. Certifications hold just as much weight in this field. Okay, so it's not just that, oh, well, they have a degree and they can do better. No, I mean, if you're looking to be a medical coder, certifications are the way to go as well. So, I mean, unless you want to be on the executive floor and you want to do the RHIA stuff, or the Registered Health Information Administrator stuff, running departments, being the captain of the ship, not really doing medical coding, but just sort of doing the business side operations, then that's what you want to look at. RHITs, a lot of them do like audits, and a lot of them are like lead coders and things like that. But you can also do that with the CCS, which is a Certified Coding Specialist through AHIMA. So unless it is a specific requirement of the company or whatever that you're going to want to work for, it's really just a personal choice. Okay, so next question, and the last question. Can an LPN do medical coding too? Yes, you can. LPNs, LVNs, medical assistants, transcriptionists, anybody and everybody can do medical coding. Okay, I mean, it's entirely up to you. If sometimes I hear from nurses that they want to make that change over into medical coding, and they're asking about the salary and stuff like that. Guys, I don't talk about salary. You can add it to your resume. You can look at the qualifications that's needed on these job listings, and I should be able to help you to decide. So if you are making the transition, and some nurses do make a very good transition into medical coding, it's really good because you have a really good background. You have a solid background in medical terminology, anatomy, physiology. You know how to work with providers from having worked with them. So there's a difference. There's a difference in a coder that used to be a nurse versus a coder that has only been a coder. You know what I'm saying? So the nurse coder is going to be, their relationship skills with a provider is going to be different from somebody who's only been a coder. That person who's only been a coder has to work extra hard for that. You know, I know because I'm there. You know what I mean? Like, I had to work very hard for the relationships that I have with my providers now, and it's really good. So I mean, it's entirely up to you. But yes, it is open to everybody. And so just think about it. Look in, do your research, ask specific questions. Any advice questions, you can look through my videos. I do have advice videos as well. When I get advice questions, it's just like very general questions. And I ask you guys for specific questions because usually if you're asking for advice, I've already done a video on it. So, but yes, ask very specific questions and I will help you out there. So I'm going to go ahead and wrap this one up, but I hope you guys enjoyed today's episode. If you haven't had a chance to, I hope you'll sign up for my Patreon pledge drive. And remember, every $1 that is pledged gets put into a bowl for my drawing for my 3 sessions via Zoom. So it can be medical coding coaching, or it could be tutoring. It's entirely up to you. So I hope you'll check out that video that talks about all of the details. All right, so if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.